I'm Dr. Petros Grivas. I'm a medical oncologist in Seattle. I'm a professor at the Fred Hutchinson Cancer Center, University of Washington. I'm so excited to be here in Portsmouth for IUCS 2025. Wonderful meeting, amazing speakers, great discussions and interactions, a wonderful forum to discuss among experts and try to delve into the details of the data sets across GU cancers. We talked about testicular cancer, kidney cancer, urothelial carcinoma, prostate cancer. A lot of common themes emerged from that dialogue. The quest for biomarkers, prognostic and predictive, toxicity management, efficacy data, evidence-based approach, understanding of mechanisms of resistance, so many questions re-challenged with the same class of therapy. All those questions, are important to answer through clinical trials. We'll look at prospective clinical trials, we'll look at retrospective data sets, real-world data, and together we'll try to answer practical questions, how to implement the data from clinical trials, real-world data sets in clinical practice. How can we personalize the treatment approach based on the totality of the available data and patient preference? And we talked about the importance of putting the patient in the center, a patient-centered approach, and ask the patient what is important for them, because different patients may have different priorities, wishes, preferences, and I think that's very important in the informed and shared decision making. We also discussed about the multidisciplinary approach and the value of interdisciplinary tumor boards and clinics and how we can implement those paradigms in clinical practice. Of course, there can be variability in the implementation of multidisciplinary tumor boards, but this is exactly what we need to discuss. How can we implement that across different settings, community practice, academic practices, and of course across different countries. There is significant variability also in the access to different regimens. For example, metastatic urothelial carcinoma in the frontline setting, the preferred standard of care is Enfortumab Vedotin plus Pembrolizumab based on the EV302 trial, but access to this regimen can vary from country to country based on the approval, regulatory, and reimbursement. So we have to work together with different stakeholders to help upon, trying to eliminate disparities globally in access to regimens that improve survival and help patients. Of course, quality of life also matters. We talked about that, and patient-reported outcomes are very important, again, to look at prospectively in clinical trials. Overall, the spirit of collaboration, the spirit of working together and trying to design trials together, getting input from patients, advocacy groups, were themes that we discussed here in the IUCS 2025. Wonderful audience, and I think overall, this spirit of collaboration is essential to try to move the field forward, try to improve patient outcomes, and try to learn from each other, because there has been a huge progress made across GU cancers, but we still have way to go, and the further progress relies on this spirit of collaboration. Great to be here, wonderful to learn from my colleagues, great to hear amazing questions from the audience, both in person, also a lot of online participants from multiple countries, and globally we continue the effort and the work in GU cancers. Thank you so much.